right, welcome back to Dr. Moses' YouTube channel and Happy New Year to you. Have you wondered when you should go to the urgent care or when should you do a virtual care? Now, this is very important because time is money. Because sometimes you go to the virtual care where the doctor refer you to go to an urgent care and you get mad because you spend money paying for virtual care and now you have to go to the urgent care and also spend money. So today's episode, I'm going to give you certain conditions or medical conditions that require that you should go to an urgent care instead of trying to do a quick televisit because it's very convenient, but you end up spending twice. And I don't want you to waste money. Having been in virtual care for many years, I can be a voice to you. So let's dive into it. The first conditions that you should not do a virtual care is any condition that requires that a doctor lay hands on you to make sure that they make the right diagnosis. Example, if you have severe abdominal pain, you don't want to do a virtual care because the doctor want to make sure they're palpating your abdomen to see where the pain is to determine if you need more testing to establish the diagnosis. But if you're just having an abdominal cramps, you ate something and you're having a few diarrhea here, vomiting, and you have an abdominal cramps, yes, you could do a virtual care. But if you have severe abdominal pain, especially if it's associated with nausea, vomiting, and also with fever, you do not want to go do a virtual care. Or if you have a condition, you're coughing, you have shortness of breath, you have a fever, and you're suspecting that you may have a pneumonia, don't do a virtual care because the doctor will not be able to listen to your lungs. And so guess what? He will send you to go to urgent care. So you would have paid twice and you don't want to do that. Or if you need any conditions that you think you may need an x-ray or an ultrasound to make the diagnosis, right? You want to go to the urgent care facility where they have those x-rays or the ultrasound. And again, I always tell my patient, for example, if I suspect that you have blood clots in your legs, or if your legs are swollen after traveling, and you don't want to do a virtual care because you may need to get an ultrasound to see if a blood clot or not. So in those conditions, I always tell my patients to go to the urgent care, and I always tell them before they go, they should call the facility and make sure they have an ultrasound before they go in there. So again, even in going to urgent care, sometimes you need to call the facility and make sure they have like an ultrasound or an x-ray before you walk in there. Otherwise, you go back there and you have to go to the ER, which is going to cost you more time and more money. Another condition is that if you feel you are dehydrated, right, you are in a heat and you are so dehydrated, you're lightheaded, and then you feel vomiting, you're having headache because you're in a heat for a long time, you are dehydrated, you should go to an urgent care where they can give you an IV fluids. So, or example, if you have a lot of diarrhea, like 8 to 10 times a day, or you're vomiting about 6, 7, 8 times a day, you are dehydrated, you are losing a lot of potassium and magnesium. And so in those settings, you should go to the urgent care where they can provide you with IV fluids. You don't want to do a virtual care visit because you losing those electrolytes can cost you your life. And another thing is that if you have a deep cut wound that is bleeding a lot, you want to just go to the urgent care and get some few sutures on it to stop the bleeding. And you may need to get a tetanus shot because if you're not up to date on your tetanus, you may need to have to be given a tetanus shot so that you don't, get more infection into the wound. Another thing is that if you have a severe burn on your abdominal wall, or even in your chest wall, or in your face, or in your arms, the severe burn that is more than just a first degree burn, and you're having a lot of blisters, you want to go to an urgent care, or sometimes even to the ER, not do a televisit. Another thing that I've seen is that if you think you need a blood work done, most virtual care do not do blood work, although certain virtual cares are now can order some blood work for you, but most blood work or needs somebody to draw your blood. So going to an urgent care is more appropriate. Or if you have, like I said before, a leg swelling, all of a sudden one of your legs are swollen, or maybe you've been sitting down for a long time and so one of your legs are swollen, or you just traveled, you flew, from let's say New York to a place about 5 hours of flight, or even on any flight, and your legs are swollen, you want to go to an urgent care which has an ultrasound because you may have a blood clot which cannot be diagnosed on the televisit. Or if you have an abscess is a swelling with pus in it. In fact, I see this a lot. So people have an abscess and they call me and they say, "Oh yeah, give me an antibiotics to go away." No, if you have a small abscess, yes, you may try an antibiotics. But if the abscess is big, you need to open it and drain the abscess, because most antibiotics will not penetrate through the capsules of the abscess. And so just taking an antibiotic will not work. You got to go in and get it opened so they can be drained for you. Another thing is people have sore throat and they are very suspicious that they have what we call strep throat. This is a big one that patients get mad about when they come to do a virtual care and we send them to go to the urgent care. The reason is most sore throats are caused by viruses. But if you suspect that you do have a strep throat, then there are 4 criteria that you got to meet for an urgent care, for a virtual care physician to prescribe an antibiotics for you. So there are 4 criteria, which is in my pharyngitis video that I did a few weeks ago. And if you don't meet those criteria, the doctor is going to send you to go to urgent care, because just prescribing antibiotics for you is very bad, because you could develop resistance if it's not a strep throat. All right. And those 4 criteria I'll go over again is a fever. If you have a swelling of the lymph nodes right here, very tender to touch, or you have pus at the back of your throat, a lot of pus, not just a white spot, but pus at the back of your throat, and you do have contact with somebody who had strep. And then the next one is we have no cough at all, absence of a cough. Then you really need to, they can give you an antibiotic if you meet those 4 criteria. But if you don't meet any of those 4 criteria, and even if you meet 3 out of 4, I will send you to go get a swab at the urgent care. So just to save you time and money, if you don't meet any of these 4 criteria, you think you have a strep throat, please don't do a televisit, go to the urgent care, because it's going to save you time and money. Another one is that if you're a man and you have a UTI, we see this a lot. Men come in, they have UTI symptoms, burning sensation, frequency, and they say, "Oh yeah, give me an antibiotic, my doctor did." No, nobody will do that for you. I mean, a good doctor will not give you an antibiotic. The reason is that in male, depending on your age, and also depending on your sexual activities, there are different organisms that can cause those symptoms. So if you're a man and you think you have UTI symptoms, you should go to urgent care to get a urine culture. And also if you're a woman and you have UTI symptoms, but the symptoms are going to your back, you're having severe pain on one side of your back or both sides of your back, you're having a fever, nausea, just aches and stuff like that, you should not do virtual care, because you may have what we call pyelonephritis, the infection going into your kidneys, and that will require IV antibiotics. Or if you need any physical exams for school or for work, this is important, because with physical exam, we are supposed to examine you from head to toe, listen to your lungs, your heart, palpate you, your abdomen. And so your virtual care will not be able to give you fill those forms for you. So it's better to go to the urgent care where a doctor can do that for you. Or if you need immediate drug testing, go to drug test, you're a truck driver, yes, go to an urgent care, don't do a virtual care. Well, there are certain conditions, especially during a winter season like this, certain conditions that you probably want to go to do a virtual visit because it's very convenient. And these are common cold. You have a common cold, yes, you should do a virtual care. There are no red flags, they don't have any neck pain or don't have a high grade fever, yes, you can do a virtual care, be able to take care of you and give you symptomatic treatment. Or if you have even sinusitis, a sinus infection, again, you have to have a sinus infection, your cold symptoms should be last more than 10 days. Up to 10 days, it's still virus, so your doctor wouldn't prescribe any antibiotics for you. But if it's after 10 days, yes, your symptoms are not going away, yeah, you should see your doctor. You may need antibiotics. And the virtual care is appropriate in that setting. Or if you have a little sprain in your leg, it's not a fracture, a sprain, you can bear weight, it's not painful, it's not very swollen, yeah, that might be a strain, and that can be treated in a virtual care. Also, if you have acute gastroenteritis, like you have just a minor vomiting, diarrhea, something that didn't fit your stomach 2 or 3 times, yes, you don't need to go to the urgent care. We can take care of you with a virtual care. Or if you have a little rash on your skin, you don't know what it is, yes, if you can take a picture of the rash, I always tell patients, take a picture of the rash, post it, and your doctor can see it. And the virtual care physician can take care of that for you as well. The other big one that you should not do a virtual care is if you have a fungal toenail, fungus of your toenail. These require that you take oral antifungal medications, and To take an oral antifungal medication, you need to do a lab test to check your liver, to make sure your liver is well before we can prescribe those. And most people come to virtual care asking for medication to treat a toenail fungus. That will not happen. You need to get blood work. And so urgent care is the first place to go so that you can have a blood work done. And if your liver is fine, then the doctor can prescribe an antifungal for you. However, if you have a blood work done already within the past 6 months and your liver function is normal, then you can do a virtual care, show that blood test to your doctor, and the doctor can give you antifungal to take once they verify that your liver is very good. Another thing is that if you have an ear infection, yes, and there's no red flags like neck pain or swelling of your face, we can do an urgent care. Now, ear infection, if you are a child less than 12 years old, we'll send you to an urgent care to be seen by a doctor. Or if you have a cold sore, yes, we can treat that. Or if you have conjunctivitis, we can treat that. What else? We can treat your vaginal yeast infection in a woman, that can be treated with virtual care. Or if you have what we call a refill of medication, just to fill medication that are not controlled substances, yes, we can give you a refill to those medications, high blood pressure medications, cholesterol medications, prostate medications. We can give you a refill. If you've already seen a doctor within the past 12 months, we can give you a refill on those medications. So there are a whole list that things that you should do a televisit and things that you should go to the urgent care. So this kind of list I'm giving to you so that you don't waste your time and money and know when to do a virtual care and when to go to the urgent care. So if this has been helpful to you, I'll post a list in the video below. You can go over them and then give us a like, subscribe to our channel, come back here to get more information on your health so that you can take care of yourself in this new year. Until then, this is Dr. Moses, and I say you stay well.